Hi guys, today we're gonna tackle about the blood transfusion, the preparation, and its procedure. But first, we're gonna know the definition of BT and its purpose. BT is a procedure in which whole blood or parts of blood are put into a patient's bloodstream through a vein. The blood may be donated by another person or it may have been taken from the patient and stored until needed, also called transfusion. The purpose is to restore blood volume after severe hemorrhage, to restore the capacity of blood to carry oxygen, to provide plasma factors or platelet concentrates which prevent or treat bleeding. Now we will gather the equipment: the blood product, blood transfusion set, 250 ml plain NSS, IV pole, IV catheter set, antiseptic swab, tape, gloves. Now we're gonna prepare our patient. First, explain the procedure and its purpose to the client. Third, if the client has intervention infusion, check whether the needle and solution are appropriate to administer blood. Third, if the client does not have an IV solution infusion, check agency policies. For our procedure, first, obtain the correct blood component for the client and confirm the physician order. Check the requisition form and the blood bag label with the laboratory technician. With another nurse, compare the laboratory blood record, the client name and identification number, the number of blood bag label, and the ABO group and RH type of the blood label and its following. Second, we're gonna verify the client's identity. Check the armband and the name or ID number. Third, we're gonna set up the infusion equipment. See the following. Fourth, the prime and tubing. Open the upper clamp on the normal saline tubing and squeeze the drip chamber until the cover the filter and 1/3 of the drip chamber above the filter. Tap the filter chamber or expel any residual air in the filter. Remove the adapter cover at the tip of the blood administration set. Open the main flow rate clamp and prime the tubing with saline. Close the both clamps. Fifth, start the saline solution. If an IV solution is incompatible with the blood infusing, stop the infusion and discard the solution and tubing and according to the institution policy. Attach the blood tubing prime with normal saline to the IV catheter. Open the saline and main flow rate clamp and adjust the flow rate. Use only the main flow rate clamp to adjust the rate. Allow a small amount of solution to infuse to make sure there are no problem with the flow or with the venipuncture site. 6. Prepare the blood bag. Invert the blood bag gently several times to mix the cell with the plasma. Expose the port to the blood bag by pulling back the tabs. Insert the remaining set spike into the blood bag. Suspend the blood bag. Close the upper clamp below the IV saline solution on the Y set. Open the clamp on the blood arm of the Y set and prime the tubing. 7. Establish the blood transfusion. The blood will run into the saline-filled drip chamber. If needed, squeeze the drip chamber to establish the liquid level with the drip chamber 1/3 full. Readjust the flow rate with the main clamp. 8. Observe the client closely for the first 5 to 10 minutes. Run the blood slowly for the first 15 minutes at 20 GTTS per minute. Watch out the adverse reactions such as chilling, nausea, vomiting, skin rash, and tachycardia. Remind the client to call the nurse immediately if any unusual symptoms are felt during the transfusion. If any of these reactions occurs, report them to the charge nurse and take appropriate nursing action. 9. Document the relevant data recorded, starting the blood, vital signs, blood type, blood unit number, sequence number, venipuncture site, IVF needle gauge, drip rate. 10. Monitor the client. 15 minutes after initiating blood transfusion, check the VS. If there is no sign of reaction, establish the required flow rate. Do not transfuse a unit of blood for longer than 4 hours. 11. Terminate the transfusion. See the following information below. 12. Follow the institution protocol for appropriate disposition of the blood bag. 13. Document the relevant data record. Completion of transfusion, the amount of blood absorbed, the blood unit number, vital signs. If the primary IVF was continued, record resuming it. Record the transfusion of the IV flow sheet and INR recorded. That's all guys. Thank you and have a good day.